I started seeing this when I was very young. The challenges of being 7 or 8 years old and being faced with this information was that when you're 8 years old, adults usually don't tell you about their health, unless it's your parents. Unless your parents are ill, then you would know. But my friends' parents aren't telling me about their health. My teachers at school aren't telling me about their health. So I just had to learn how to listen really well, because I would notice these textures, and then I would hear people in conversation, kind of like at the dinner party, where I would overhear what someone just found out they've been diagnosed with this, someone just found out they've been diagnosed with that. Or like when I was in grade school, I would notice one of my teachers had one of these textures, and then one day a substitute teacher would come in and say, "Class, Mrs. Jones is in the hospital and she's going to be away for a couple of months. I'm now going to be your substitute teacher until Mrs. Jones is well enough to come back." So that's how I just started getting bits and pieces of that. And I did that until I was about 38 years old. In the late 90s, when medical intuition became rather popular and started showing up on a lot of the daytime television shows, I said to myself, wow, I thought everybody knew about this, or I didn't know it was like television worthy. I didn't just figure everybody knew about this. That's when I started reaching out to medical doctors, because I said, look, I can come into your office. You already know what your patients are diagnosed with. I'll come in and look at them. They can't speak. And I will tell you right away what I see, and you can instantly evaluate what I have to say. And how well do you think that went when I started reaching out to medical doctors? I mean, even though television made it look like conventional medicine was now making an intuitive turn, just the average doctor or healthcare system was not. And the reason I have this here was there was a doctor in Pennsylvania who said, okay, a lot of doctors I talked to were interested personally, but they're like, I can't do this in my practice. My patients will flee. They'll think I'm crazy. So what you'll do is you'll come to my doctor's office and you'll sit in the waiting room, acting like you're a patient waiting to be evaluated. And you'll look at the other people in the waiting room. And then when they leave, then you'll tell me what you see, and then we'll see if it's right. And I said, well, ethics says that people that are in some kind of a study need to be aware that they're in some kind of a study. You can't be secretive about it. So this was my joke in terms of like I'm going to be hiding in the waiting room like with Ranger Rick magazine with the eyes cut out, kind of looking around. But eventually I did find a clinical professor of medicine at George Washington University and an adult nurse practitioner and gestalt therapist in private practice in Bethesda, Maryland, and we wrote about our adventures in the book that most of you have read. Has anybody not read it? I just want to know just as I'm going over information. Okay, so basically in the evaluation, so I was there for 16 months, and the way a hit was registered was there had to be a conventional diagnosis for when I saw a certain situation. Now I want to be very clear, I do not see illness indicators, I see organ indicators, okay? So I don't see a diverticulosis indicator, I don't see a hepatitis indicator, I see a digestive indicator, or I see a liver indicator. So again, I'm not a doctor, I'm not diagnosing. So if I looked at someone and said, I see a thyroid indication, and they were diagnosed with Hashimoto's disease or Graves' disease, that would be a hit. Yes, yeah, hit that bell if you want to.
How does medication change it? Like if you had thyroid and then you're taking a thyroid supplement to support your thyroid, can you still pick up a thyroid issue if the medication is correcting it?
If the medication is effective, it can reduce the intensity of an indicator. If the medication is ineffective, then the indicator would prevail. Mm-hmm. You would still see it. And we'll talk about some of those examples. Yes?
Do you find that it kind of fits with like Chinese face reading?
No.
Not at all.
No. Because I'm going to say, my knowledge of Chinese face reading is it's somewhat symmetrical, or, how are your earlobes connected, disconnected? What's the difference between here and here?
Well, like certain things like, stuff on your cheeks is connected to your skin is connected to your digestive system, and your small intestine, this part of your forehead is connected to your bladder.
No, it's not like I look for thyroid here and liver here or that. The face to me is like a gramophone. It's a sound horn, so it's just all information coming out. I want to say what the difference that I might know between what I do in traditional Chinese medicine is in my model, when people get well, the indicator goes away. In traditional Chinese medicine, I don't know if the distance between your upper lip and your nose is going to change, or those kind of facial recognition features.
Your features don't change, but let's say if somebody has, what, well, you would know better than I actually, but like somebody who has, let's say, kidney issues or whatever, might get the puffiness around their eyes, or someone with liver issues might have, you know, darker circles under their eyes, or those kinds of things do tend to come and go depending on someone.
Yeah, I'm going to say those are physiological traits, and we're not looking for physiological traits. Okay, and we'll get into those details when you start seeing indicators. So if I said thyroid indicator and they had Graves' disease, hit. If I look at someone and say, I see a thyroid indicator, and they go, no, everything, just had a blood test, everything's fine. But then 6 months, so that's a miss. But then 6 months later, they come back and have another blood test, and now they are hypothyroid. That is still a miss, because it had to be at the time of evaluation. They can't go back and change my miss to a hit. All right? If I were to look at someone and say, I perceive a hearing indication, and it could be affecting their ability to hear, and the conventional diagnosis or the medical team would say, no, you know, their hearing's fine. And the patient goes, no, wait, last couple months I've had some difficulty hearing out of this ear. Patient testimony is not diagnosis. So that would still be a miss. But given those parameters, it was still about 93% accurate, you know, in terms of how it went. And when the medical team first had me come to their office, when I called them on the phone and said, you know, hey, I can just come in and look at people, they're like, oh, okay, come on down. I thought we were going to have some kind of conversation at the medical office. They just brought me into patient rooms, that whoever was there that morning, and just said, evaluate. And so based on that day, they were like, okay, well, we're willing to work with you. You know, they didn't want to hear stories. Okay. Yes?
So with your 90% effectiveness, did you evaluate at all post the misses that turned into hits later as part of that? To have a number for that? I'm just curious.
No, we did not. But the medical team was pretty, they weren't so rigid in that regard in terms of like, well, you missed. Or they noted like, okay, you obviously are picking up on indicators before our medical tests can.